Gynecology update 2025 for an audience of Indian gynecologists. It includes the latest clinical advances, regulatory updates, new diagnostic tools, treatment options, evolving guidelines, and public health developments. Cervical cancer screening, Teal Wand, FDA-approved self-collection device, May 2025, at-home cervical screening, 96% accuracy in detecting precancerous lesions, expands access, useful for underserved populations, designed for women aged 25 to 65. The Teal Wand is a breakthrough in cervical cancer screening. It empowers women to self-collect samples with high accuracy. Pilot programs in Maharashtra and Tamil Nadu are being considered to evaluate feasibility in rural areas. Could revolutionize screening in rural areas, though CDSCO approval is pending. Consider pilot studies in collaboration with NGOs. Fluorescein, new STI treatment. First FDA-approved oral antibiotic for gonorrhea indicates non-inferior to ceftriaxone plus azithromycin, awaiting CDSCO approval. It is a promising alternative for treating gonorrhea, especially as resistance to cephalosporins increase. While not yet approved in India, it may soon be integrated into syndromic STI management protocols, primarily for the treatment of uncomplicated gonorrhea caused by the bacterium Neisseria gonorrhoeae, including multi-drug resistant strains. It is part of a new class of antibacterial agents known as spiropyrimidine triones. Fluorescein is promising from India, where gonorrhea resistance is rising. Mental health in menopause. 30% of women in early menopause experience depression. It is not just hormonal, it's linked to identity and grief. You may recommend PHQ9 screening during gynecological visits as needed. Mental health is often overlooked in gynecological care. Depression during menopause is multifactorial. Incorporating PHQ9 screening into routine visits can help identify and support affected patients. 3% IVF UK breakthrough. Combines DNA from two parents plus one donor. Prevents mitochondrial diseases. 8 healthy births have been reported in UK. Ethical and regulatory implications for India. 3% IVF is a major advancement in reproductive technology. While not yet approved in India, it raises important questions about genetic counseling, ethics, and future ART regulations. Breast cancer risk reduction. Emphasis on early screening, mammography from age 40. Role of diet, exercise, and hormonal modulation. ICMR has updated the guidelines in 2025. Breast cancer remains the leading cancer among Indian women. Early screening and lifestyle interventions are key. The updated ICMR guidelines support mammography starting at age 40 for average risk women. Update on gynecological cancers. The treatment landscape for gynecological cancers has seen remarkable progress. New systemic therapies, especially immunotherapies like checkpoint inhibitors, are revolutionizing care for cancers such as endometrial, ovarian, and cervical cancer. Checkpoint inhibitors such as dostarlimab, durvalumab, and pembrolizumab have significantly improved outcomes in advanced endometrial cancer. For ovarian cancer, targeted therapies like PARP inhibitors, including niraparib, olaparib, and rucaparib, have become standards for maintenance therapy, showing substantial improvements in progression-free survival. In cervical cancer, immunotherapy combined with HPV vaccinations and antibody drug conjugates, it's opening new treatment avenues. The global push for HPV vaccination remains critical, with the monovalent vaccine showing near 100% seroconversion and over 95% reduction in pre-invasive and invasive cervical lesions yet vaccination coverage still needs improvement worldwide. Beyond oncology, gynecological care continues to incorporate more personalized approaches with new biomarkers guiding targeted therapies. Advances in ultrasound sound and minimally invasive procedures improve diagnosis and management of conditions like placenta previa, ectropion, and other common gynecological disorders. Mirvetuximab soravtansine is the first antibody drug conjugate ADC approved for platinum-resistant ovarian cancer patients expressing folate receptor alpha, showing promise in advanced endometrial cancer. Marking a new targeted therapy options. Emerging use of combined therapies like palbociclib, a CDK4/6 inhibitor with anti-hormone treatment, and antibody drug conjugate shows promise in advanced endometrial cancer. Immuno-oncology trials in cervical cancer, Keynote A18 and BEAT-CC have opened new immunotherapy venues. Important ongoing emphasis on HPV vaccination for prevention, with the non-covalent vaccine demonstrating near 100% seroconversion and effective in reducing cervical and other genital cancers. That's all for today. Follow me and subscribe. Thank you.